Good afternoon. We're here with Dr. Larry Klein of St. Petersburg, Florida. Dr. Klein, thank you very much for being with us today to talk about your practice, your dentistry practice here. And I don't know how many people are really aware of what the real overall health benefits are for good dental practice and good oral health care to my overall well-being and my health. Can you talk a little bit about that, because I think it's really, really important.
Sure, be glad to. Most people know that the mouth is the entryway for the whole body. There are so many things that bacteria builds up in the mouth, and there's now substantial evidence that the actual bacteria and inflammatory processes that go on in the mouth actually end up being a systemic problem also. That gets into heart disease, strokes, low birth weights in babies, ties in with diabetes, high blood pressure. So all these things definitely all tie together and become a very much of a indicative portion. The mouth becomes an indicative portion of what's going on in the rest of the body.
Are there things throughout the course of a day, other than just brushing your teeth, that you should or can do to stave off some of the bacteria that develops in your mouth?
I mean, obviously just keeping your mouth rinsed out, keeping on a daily basis. Sometimes if you can't do it that moment, that instant, simple things like just rinsing your mouth with some water, okay? If you spit it out or swallow it, that's just keeping things, the acidity levels low. Some of the gums are good for helping to stimulate the salivary flow, but once again, don't want to overdo on the gum, because then that can affect your joints there too. So a little bit of gum's good, too much is bad. So
and sugarless always?
What's that?
Is it always sugarless?
Always sugarless, without
Okay.
a doubt. Without a doubt. And definitely, if you got the other part that is very indicative is some people, especially on medications, will end up having a lot of dry mouth. Well, the dry mouth becomes a severe problem, dental problem. So things to avoid, mints, cough drops, things like that end up sitting there in the mouth, causing more and more bacteria buildup, and then ends up causing more decay and tooth problems.
Well, excellent. Dr. Klein, thank you very much.